Okay, so here's a example of what we call the spinal cord right there. That's the spinal column that protects all the nerves. These yellow little lines here are the actual nerves in the body. You can see your spinal cord runs right down the middle. There's nerves that run down the left hand, the right hand, the left leg, and the right leg. Each of these yellow lines represents a single nerve in the body. Each nerve is protected by a particular bone in the body. When we talk about pinched nerves or decompression as it treats pinched nerves or disc bulges or herniated discs or spinal degeneration or spinal stenosis for that matter, it all affects certain parts of the body. This is the neck area up in here. This is the lower back area, down in here. Each of these bones is going to have a particular function. For instance, this very top one here in red. If we have any problem with that particular bone, it's going to affect the head, the pituitary gland, the inner ears, the nervous system, the eyes, those kind of things. If we drop down a couple down to this one here, which is called C5, that represents the fifth bone in the spine, in the neck area. It would protect the vocal cords, the neck glands, and the pharynx. Also, you can see, though, it causes pain to emanate and radiate down the hands. That's what the little red lines indicate. Go down to the sixth one, and you can see that it causes pain across both shoulders. Here in the red, pain up the back of the neck, and again, more down the arms. Go down another one, and you can see how it starts to affect the hands and elbows. Now, if a person were to have a herniated disc or a bulged disc in the neck area, for the most part, their symptoms are going to be down in the lower arms and hands. It could be numbness, it could be tingling, it could be severe sharp stinging. In the latter stages, it even causes you to lose strength and not be able to hold coffee mugs and things of that nature. You're dropping pencils and so forth and so on. If we move down in here to the lower back, we'll pick the fifth one here. That's that particular bone right there. You can see that if you pinch the nerves or pinch that disc together down there on the fifth bone, your symptoms are going to start from the lower back and go right down the legs. You could have numb feet, numb tingly toes. You could have pain shooting down your legs, down the back of your buttocks, all the way to your feet. Your feet could feel like they're on fire. Some people experience what's called restless leg syndrome. Restless leg syndrome is where the nerves at night are misfiring because of pinches that are occurring down in this part of the body. So if you move down or move up to the third one here, you can see how it would affect the knee area as shown in red. But here's an interesting thing. It also shows the colon and the bladder. A lot of our patients have problems with their colon and bladder at the same time they're experiencing back pain. Well, the reason for that is because the same exact nerves that radiate down the legs and cause your knees to hurt and your feet to hurt are the same ones that make your colon work and make your bladder work. So we actually can treat those conditions by alleviating the symptoms of colon or bladder problems by decompressing or unpinching the nerves of the lower spine. We've had very, very good luck with that, and our patients are extremely happy with that. So this chart is an indication of what part of your body can be affected based on what part of your body is pinching the nerves. Very discreet, very obvious, and pretty much the same on every patient we have. Hopefully we can, with treatment, reduce these symptoms and eliminate the problems, and at the same time correct them so that they don't return. We do that through a combination of neurological treatments, chiropractic treatments, but primarily we do that through decompression treatment, where we would literally alleviate the symptoms by creating space or creating movement down here in this lower spot or up here in the neck region, unpinching the particular nerve right here that's causing the symptoms down the arm. And by doing so, we can correct the problem.